Calvin. I'm President and CEO of the United Nations Foundation, and I am fortunate to be doing a Facebook Live today with Beth Schlachter. Beth is the Executive Director of Family Planning 2020. It was founded 5 years ago with the goal of making sure that 120 million more women and girls and men around the world would have access to voluntary modern family planning services. And great work that we've seen over those 5 years. And today, Beth, you are releasing the annual report that talks about where we are today. And so we're going to ask Beth 5 questions. Maybe I'll sneak an extra one or two in. But I want to really make sure we talk about how we got here, what we've learned, where we're going to go, and how do we make sure that every woman, every girl, everywhere has the opportunity to plan her future. So let's start with the evolution of Family Planning 2020, Beth. How did it start? What were you trying to do as this thing took off and got off the ground 5 years ago?
Great. Thanks, Kathy, and thank you all for joining us here today. It's really exciting to be launching this report, and we're thrilled to have you join us to learn more about family planning and the partnership that we have to help support it moving forward. So 2012, taking us back in time a bit, we were finishing up the Millennium Development Goals. We were furthest behind on reproductive health of any of the goals for women. And there was a recognition that a lot of funding had gone into the health sector. We were coming out of the AIDS crisis. And so a lot of the creativity, a lot of the funding had gone in to resolve that medical emergency around the world. And in those years, reproductive health and family planning in particular had languished as a development issue. And so many of the global partners got together to bring attention back to it and to see what more we could do if we worked in partnership to support countries to reach their goals. So we asked country partners, particularly those in the 69 lowest income countries, to decide for themselves and then share with us what they wanted to do. What were their goals? What did they want to accomplish? So countries set those goals. At that point, we had 24 countries who set family planning commitments. Now we have 41. So there's been enormous momentum over the last 5 years to see what a partnership that brings global development partners, individual donors, foundations, technical experts, and the countries themselves together to resolve some of the persistent challenges. So it's been exciting to learn from country partners about what more we can do with them to support with their commitments and their goals in the lead.
So this is your new report, and I'm just going to hold it up because it's quite beautiful. But tell us about this report. What have you learned, and where have we gotten to? I know we have some impressive new numbers, but the numbers are only part of the story. It's really who you're reaching and how you're reaching them.
Yeah, and I think that's what's important to understand about data. It is a beautiful report. We're very proud of it. The data does tell us how we're reaching these 120 million additional women and girls. So family planning partners know that there's been a lot of effort over the last 50 years to reach women and girls with reproductive health services. So we're building on the shoulders of a lot of work that predates our partnership. But now we have 309, almost 310 million women and girls in the 69 poorest countries who are using modern contraception. That's almost 40 million more than when we started. So we're accelerating the pace of progress in terms of reaching people with the services they want, but we're learning how to do it more effectively. We're learning that when countries are in the lead, and this is a development priority from the president on down through a government, that opens up the channels to resolve some of the persistent problems. Because family planning, when you get down to the essence of reproductive health, is as much a cultural issue as it is a health issue. So you have to overcome some of the barriers for women accessing contraception. And a partnership...
Just say what those are.
Okay, so for a lot of women, even within their families, the idea that you would time or space the number of children that you have, or that you might want to limit the number of children, is really a modern idea or a revolutionary idea. So if we can help people to understand, if you time and space the births, that the mother's going to be healthier in between, the child will be healthier when they're born, the family will be able to recover economically as well, and to be able to care for those children in a way that will sustain them in a healthier life course, be able to afford better food, be able to provide vaccinations, go to schools and be able to pay school fees. So as families are able to plan and economize for family or for their children, we see better health outcomes and better economic outcomes within families. So again, women realizing that they can have access, that their families support them to have that, and then when they go and ask for the services, that they're treated respectfully, that it's seen that they have a choice, that they can access a range of methods, maybe at one point something that limits on a shorter term the number of children you have is a good idea. Maybe you're done having children and you want an IUD, you want an implant for 3 or 4 years, or you want sterilization. You want different services at different times in your life, and I think all women understand that. And so we want to have quality services that are available. So if we have countries that are in the lead in terms of shaping that and then helping to overcome some of the barriers that are faced within that, we find we have better outcomes.
So this is making me think about how important family planning is to having a ripple effect on reducing poverty. Because if you've had all these children, it's so much harder to break out of poverty and change the dynamic of your family. And we certainly know the demographics in many of the poorest countries are average age 16, average age 18, compared to here in the U.S. where the average age is 38. So we know we're dealing with young women with a long cycle ahead of them. So how is family planning now seen in the development community? How is it seen as a critical underlier for all of the other important implementations that the community is thinking about?
Yeah. I think that there's a better understanding, particularly with the Sustainable Development Goals. And for those who aren't as familiar, there are 17 Sustainable Development Goals. And USAID actually put out a paper last year about the impact of family planning on each one of these development goals, because you can think about population dynamics in terms of the environment. The number of people we have and the rate at which populations expand have an impact on the environment. Yeah. They have an impact on water, on sanitation, on, again, local economies. So any development issue that you want to look at, there's a population dynamic to it, and there's a women's empowerment element to that as well. Because women are over 50% of the global population. If we want stronger economies, then women need to be able to participate in the workforce. We need them to participate in political processes as well. So if women can decide when they want to have children so that they can continue to develop other aspects of their lives as well, then we'll see a ripple effect across that too. The other point that you touched on that I don't want to lose, and I heard a statistic today that there are 750 million women alive in the world who had their first child before the age of 18. So if we're thinking about early childbearing, and most of those women had those children while they were already married. So if we're changing some social norms around when women get married, it means that we're also changing how long they stay in school, the education they have so that they can build their family's economy over their life course. All of these things are interconnected, and they all have economic impacts as well as environmental and very personal ones as well. So it's a really complicated matrix, but family planning is there across the board.
Well, so Family Planning 2020 has really prioritized reaching young people. Mm-hmm. What are you finding out about where you need to go to make sure you're getting them the services and advice that they need? Sometimes that's the hardest thing, to not go somewhere where your mother or your aunt or someone in the community might be seeing you. So what are you learning about how to make that more effective?
Yeah, that can be a really tricky issue. One of the greatest things about young people is how connected they are to one another. Mobile technologies can be really helpful to ensuring that young people have the information about their bodies, about the services that might be available, about what different contraception might even exist, and what the side effects might be so that they know how to prepare for that. And then trying to break down those sort of networks of communication so young people know where they can go to receive respectful services. And these are services that should be integrated into primary health care. Now, sometimes if you live in a very rural area, you're going to have fewer choices about where you can go. And when you go for these services, they might be with people that you're related to or that you know yourself. So those are areas where it can be really challenging to provide services for young people that are really open, where they can have the kinds of conversations and counseling that they need. That's a really tough one to crack. Where we have greater flexibility can be where the communities are bigger and young people have more choice. Schools remain important in terms of curriculum and people understanding both, again, the biological changes they're going to face, the emotional changes, the relationships that are on the horizon for them. Those are tricky waters for everyone to navigate, and the more open and honest we can be and the better sharing of information, again, mobile networks can take care of some of that by providing evidence-based information to young people that they can then share as well. So there are a lot of different ways we're trying to approach young people to give them the information they need and make sure that their own networks are empowered to take care of that communication themselves. The last piece I'll say about that is ensuring that, again, it's a political priority within countries, that they respect the needs of young people and that they're making sure that they're planning for their needs both across education and within health systems as well.
Well, so you've said that, and I recognize earlier you mentioned how important it was that this is a movement and a network of partners. Certainly the UN Foundation is a partner, and we've been proud to host Family Planning 2020. But say more about the other partners and how essential it is that this is a full-on community of committed partners.
Yeah. Thanks. Well, I'll start with the countries. Where we've seen the greatest change and the greatest development growth are when countries are investing in their own people. So when they're developing healthcare plans that include access to contraception, that include everything you need for safe delivery and safe transition throughout a woman's life course, a reproductive life course, you see much better outcomes. Because then they'll plan for high quality services. There will be respectful care where a woman can go in and talk about the range of her needs, and she can transition throughout the course of her life to the kind of, again, contraception that she might need. If countries can open that up from the leadership level down, then they can plan, again, within their entire health system to meet those needs and get much more positive outcomes. And then when countries can share their learning about what's working and what they've needed to do with other countries in the region, they can learn again from one another and grow their programs. And then globally, where we have funding partners, including the U.S., the UK, have been the largest traditional funders. We have a lot of foundations who are doing a lot of work on this now, including Bill and Melinda Gates Foundation, the Children's Investment Fund Foundation, who are looking at it from an education as well as a service delivery side. These partners are coming together with traditional UN partners like the UN Population Fund, the World Health Organization, and others to really have a holistic framework that meets the needs of women across the spectrum, no matter where they're living. And you started out by referencing every woman everywhere. And we're working more as well with humanitarian or colleagues who are working in humanitarian sectors. Very difficult, and to ensure that even if contraception is provided in the early stages of an emergency, that we plan for the continuum from an outset of an emergency through relief on back to development, because there are times during that transition that it can be difficult to ensure that reproductive health care is provided across these transitional phases. So there's a lot more for the development community to learn together to make sure that we're filling all of these gaps.
Well, you mentioned USAID, and of course you and I are both Americans, and the U.S. has been a generous supporter of family planning for many, many years. I think it's important for us just to acknowledge how important that kind of support has been, and that we hope it will return in the future. But when we think about the future, where do you see this movement going, and how do you build on the great achievements you've had? You had an amazing summit earlier this year in London with lots of different partners, but where do you see the movement going, and what's it going to take for us to get to that goal of everyone having the access and opportunity?
You know, I think that many of us have been quite moved this year to see women in the streets for other women. For the first time, really, in my lifetime, where we've all been out in solidarity, just saying that the basic needs of women and girls can't be ignored any longer. And when it comes to our gender, nothing is more fundamental than reproduction. I think we're both sitting here because we've been able to decide for ourselves a lot of aspects of our lives, and we want the same thing in solidarity with women around the world. So I hope our movement will continue to really have women and girls front and center in our minds as we move forward. I hope that we continue from 2020 on to 2030, because there's really no stopping us. We have a partnership that's aligned around what countries need, and they're better able to now tell donors, if you work with us in partnership to meet our goals instead of working on your own sort of areas of bilateral interest, we can achieve a lot more together. And that's a transition in thinking that was hard to get to, and now that we're there, I can't see us turning back, because think that we've learned so much, and countries are just thrilled to have this kind of donor alignment behind their own goals and visions. Everybody's learning how to work together, I think, in a more seamless way. It's not perfect everywhere. I don't want to overstate that. But there is something about partnership that makes everybody feel that solidarity that has stronger outcomes no matter what you're working on. And we've certainly seen that through FP 2020. And it's been an honor and a pleasure to see how all of that's come together. And that's what's different in this report is we try to tell the story of that partnership. We try to say, how are all these pieces coming together at the country level, supported by global partners, but really led from the grassroots up in order to deliver the kinds of outcomes that we want to see.
Well, I think the moment of empowerment that you are working on toward for girls, for women, for families, for communities is really the ripple effect that we're feeling all over the world. So Beth, thank you for all the work you and all the members of the reference group and Secretariat for Family Planning 2020 have put into this report, and I hope you'll all join us in making this a cause that you care about too. Everyone in the world deserves the same kind of dignity and opportunity to shape her own life. And thank you, Beth.
Thank you, Kathy.